Welcome to this explainer. We're diving straight into the realities of hemodialysis and empowering you with some truly actionable lifestyle strategies. Whether you're starting this journey yourself, supporting a loved one, or just curious about this incredible medical tech, you are absolutely in the right place. We're going to break down the mechanics of the machines, explore exactly how your body reacts, and equip you with the mastery you need to really optimize your quality of life. So let's just get right into it.
Here's our roadmap for today. We'll be covering how hemodialysis actually works, inside the dialysis machine, understanding disequilibrium syndrome, mastering your fluid restrictions, and finally, the nocturnal dialysis option.
Section 1. How hemodialysis actually works. To start, we really need to understand the underlying problem of kidney failure and the mechanical solution that hemodialysis provides. You see, when kidneys fail, they can't do their essential jobs anymore, like cleaning out toxic wastes such as urea and creatinine, removing excess water, and neutralizing blood acidity. Hemodialysis basically steps right in to take over those exact jobs.
Take a look at this complete hemodialysis circuit. It acts as a brilliantly smart filter when your natural kidneys just can't keep up. Your blood safely leaves your body, travels through a pump, enters the dialyzer, which is essentially your artificial kidney, and then returns to you completely clean. It's a continuous loop, mimicking the constant, effortless filtration your kidneys used to do.
So here's the sequential journey of your blood. It's constantly cycling out, getting purified, and flowing right back in over a period of about 4 to 5 hours. It starts at the AV fistula. This is a surgically created connection between an artery and a vein, usually right in your arm. Think of this fistula as your lifeline. It provides a safe, high-flow exit point. From there, the blood travels through the dialyzer, and finally, clean and perfectly balanced, it returns safely back to your body.
Now, what's really fascinating here are the two invisible forces doing the heavy lifting during your treatment. On one side, we have diffusion. Because your blood is packed with waste like urea, but the dialysis solution has absolutely none, that waste naturally diffuses over to the clean side to balance things out. On the other side is ultrafiltration, and this is all about fluid. The machine uses a pressure gradient to physically pull that excess water right out of your blood.
Section 2. Inside the dialysis machine. Let's take a quick tour of the actual hardware that makes this life-saving filtration possible. It's an incredibly complex machine, but modern engineering has made it highly reliable and incredibly efficient.
Here, you can see the specialized, pliable bloodlines. These soft, flexible tubes are what carry your blood. They also include a tiny injection site for an anticoagulant, usually heparin. That's absolutely crucial to keep your blood from clotting while it's outside your body. And right alongside that is the core of the entire system, the artificial kidney itself, known as the dialyzer.
Inside this cylinder is where the real magic happens. Your blood flows through thousands of semi-permeable, microscopic fibers. And semi-permeable basically means it acts like a tiny bouncer at a club. It keeps your vital blood cells safe and secure inside the fibers, while letting the tiny toxic molecules and excess water slip right out through the walls.
But you know, the unsung hero of this whole process is the dialysis solution, or dialysate. The machine meticulously mixes it using highly purified water, and I mean incredibly pure, because any contamination at all could enter your bloodstream. The machine blends this pure water with essential electrolytes, like calcium and magnesium. As this solution flows around the outside of those tiny fibers while your blood flows inside them, it acts like a giant magnet. It draws impurities right out of your blood and washes them straight down the drain.
Section 3. Understanding disequilibrium syndrome. Now, dialysis is incredibly effective, right? But sometimes, especially when you're just starting out, those rapid changes in your body chemistry can actually lead to a complication called dialysis disequilibrium syndrome, or DDS.
DDS usually pops up when someone is brand new to dialysis or maybe has missed a few treatments. Because the machine is cleaning your blood so incredibly fast, it can trigger some really sudden fluid shifts. Now, it's usually mild and self-limiting. You might get a headache, a little nausea, maybe some blurred vision, but it can definitely be intimidating. And in very rare, severe cases, it can lead to more serious neurological issues.
To really figure out how to manage DDS, we have to ask a crucial question. Why does it cause the brain to experience this temporary, uncomfortable swelling, also known as cerebral edema? Well, the answer lies in how different parts of your body react to that sudden cleaning of your blood.
It all comes down to something medical professionals call the reverse urea effect. See, during your first few treatments, the machine scrubs the urea out of your bloodstream incredibly fast, but the urea trapped inside your brain tissue That takes a lot longer to clear out. This creates a temporary imbalance. The high concentration of urea left in your brain acts like a sponge. It creates an osmotic gradient that literally sucks water from your bloodstream straight into your brain cells, causing them to swell up.
But hey, the good news is your medical team has a fantastic, well-established toolkit to prevent this entirely. The main strategy? Just slow things down so your brain has time to adjust. If you're new to dialysis, your doctor might start you on short, 2-hour sessions with a really gentle blood flow rate. They can even use a cool feature on the machine called sodium remodeling to keep your fluid balance totally stable. The big takeaway here is communication. If you feel a headache or any nausea during treatment, you've got to let your team know immediately.
Section 4. Mastering your fluid restrictions. Transitioning from the clinic back to your everyday life, managing your fluid intake is without a doubt the absolute most critical lifestyle adjustment you're going to make.
When your kidneys can't balance fluids anymore, you're forced to restrict them. If you don't, you risk fluid overload, which puts a massive strain on your heart and lungs. And that brings up the biggest daily hurdle for pretty much any dialysis patient. How do you beat the thirst? How on earth do you stay comfortable when your fluid intake is so severely limited?
Well, instead of just giving you a boring list of don'ts, let's look at some highly effective, actionable hacks to comfortably stretch that daily fluid allowance. First off, divide your allowance into scheduled portions, like 4 equal drinks spaced throughout the day. Second, try using mouthwash, mints, or sour hard candies. These actually stimulate saliva production and instantly relieve that dry mouth feeling. Third, snack on frozen grapes or blueberries instead of chugging a glass of water. And finally, you absolutely have to cut the sodium. Salt makes your body crave water. Drop the salt, and the thirst drops right along with it.
And here is a real game changer for your daily fluid budget, 50%. Because water physically expands when it freezes. Consuming a solid ice cube gives you about 50% less water by volume than drinking liquid water. Crunching on an ice cube completely satisfies that urge to drink, while secretly cutting your fluid intake in half. It's a simple, brilliant hack to help you master those restrictions.
Section 5. The nocturnal dialysis option. Finally, let's explore a lifestyle optimization that completely flips the traditional treatment schedule right on its head. For some patients, this is a total paradigm shift.
So, standard daytime dialysis typically lasts 3 to 5 hours. Because the machine has to remove a lot of fluid and toxins in a really short window, it can sometimes leave you with cramping, low blood pressure, and this washed-out feeling where you just need a nap. But nocturnal dialysis, that happens overnight while you sleep at the clinic, lasting about 8 hours. Because the treatment is stretched over a much longer period, the fluid and toxin removal is way slower, making it incredibly gentle on your body.
By essentially treating the dialyzer like a natural kidney over that longer time frame, you unlock some absolutely incredible physical and psychological benefits. For starters, you lose 0 daytime hours to treatment. Patients consistently report feeling significantly better with a bigger appetite and way more diet flexibility. Physically, you're looking at less cramping and far fewer blood pressure drops. And perhaps most astonishingly, data from pioneering programs in France show that this slower, extended treatment actually leads to significantly lower cardiovascular mortality rates.
Now sure, it does require sleeping at the clinic a few nights a week and dealing with some minor nighttime interruptions for things like blood pressure checks, but many patients report getting a brand new zest for life. They don't feel like their days are constantly interrupted anymore. They can work, go to school, socialize freely, all because they literally turn their non-productive sleep time into life-saving treatment time.
So as we wrap up this explainer, remember this. While kidney failure undeniably alters your path, you are absolutely not powerless. From understanding the life-saving mechanics of the dialyzer and communicating with your team to prevent disequilibrium, to mastering your daily fluid budget and even exploring empowering options like nocturnal dialysis, you have the tools. Kidney failure changes your body, but with these strategies in hand, how will you choose to live your life? Thanks so much for joining me on this deep dive.